start the event. So sorry for the delay and please wait for a while. And when guests are coming and we can get it started, we are going to wait for a while. And please excuse us for the delay. Had some traffic jam, but today we have some breakfast restaurant delays, so we are waiting for more guests. And once we have some more guests coming in, then we can get it started. Please wait for a while. We are expecting more guests, and then I'm going to announce when the event will begin. Sorry for the delay. Alright, we're gonna start the day two of the Jupiter International Symposium. For those of the guests who are coming in right now, make sure that you take a seat. In a minute, we're gonna start the day two of the Jupiter International Symposium, Once everyone is ready, we are going to start the event. Thank you for coming. Now we kick off the day 2 of the Jupiter International Symposium. Yesterday, there was a traffic jam and there was some delay, but today, and because of the delay in the breakfast, we had a bit of the delay, and please excuse us once again for the delay. Today, we have lots of gifts ready for you. Please stay with us till the end of the event. Yesterday, we had a lucky draw for 7 people, but today, we have 13 people who are going to get the gift. And especially, you can get the Paradise Hotel voucher. That's going to be a big gift. So please stay with us till the end of the event, and please enjoy the event as well. Now we can start the morning session for today. On the day 2, the moderator will be Dr. Yoon Jung-hyun. Dr. Yoon graduated from the Yonsei University and currently he is running Yonsei Farms Clinic. And he was the chairman of the Korea Aesthetic Surgery of the Laser Society, and he has been working really hard for the development of the academia and the young doctors. Please welcome Dr. Park. Dr. Yoon, sorry.
Thank you for the kind introduction. And yesterday, until very late hours, we had a panel discussion that lasted until 10:30, and we had a great opportunity to have exchange of information between domestic doctors and international doctors. So we are now starting day 2 event, and from Poland, and we invite leading doctor. So Dr. Bartek will make a presentation, and after that there will be panel discussion. As you're well aware, in August 2022, the Jubaric launched in the market. So doctors who gathered here provided tremendous support, and also the result has been shared in the Korean society and also international society. That's why we are having the first Jupiter Symposium today. So following the yesterday's heated discussion, we are going to have another good, informative discussion. So let me introduce our speaker. So our speaker is from Poland. So the Bartek Sobolewski will make a first presentation today. So Juvaruk is consumed in Europe. In particular, Poland is one of the major markets, and Dr. Bartek is a leading doctor. So this will be a great opportunity to share his know-how and clinical data. This will be a great opportunity to get to know about European aesthetic trend, aesthetic insight, the latest European aesthetic trends, and the position of Juvaruk in Europe is the presentation title. So let's invite him.
Hope you enjoy your stay. I would like to thank you, Global Vime and Beauty Europe, for invitation. It's, as usual, a great honor for me to present my considerations about a European aesthetic point of view in case of Juveluc and Lanisna or Juveluc volume application for our patients. Okay. So what we usually get as we observe European aesthetic medicine, we start observing pillow face, not only in Europe but also in the United States. It's not a very nice effect. The overfilling as effect of over implication of cross-linked hyaluronic acid. We observe many patients with pillow face, with edema, with migration of hyaluronic cross-linked fillers. So we don't want such effects, and our patient also don't want such effects. We want a natural look. We have a few Hollywood stars that present such a natural, fresh look despite their age. So that's why the European aesthetic trends are as so. A reasonable botulinum toxin injections to avoid mask effect, of course. So we started to dose a little bit less than a few years ago to get a very natural and movable face. We observe significantly decreasing cross-linked HA fillers popularity because patients are aware of pillow face complications, of possible vascular complications. They, of course, demand extremely natural look, and they demand long-lasting effects. So we are obliged to do something more or different than HA fillers, which are still very popular in many countries in Europe. Also, there is increasing patient awareness about modern products. They know a lot of different new methods, new injections, new products. So they demand from us, from our clinics, to do something modern, something better than HA fillers. Patients are more focused on global skin rejuvenation than specific injections to, for example, increase volume of cheeks. They want a global skin rejuvenation, or they want their skin not only in face but also in the whole body to look better. Apparently, we observe, of course, the growing popularity of PLA products, which, of course, PDLA products are, as a third generation and most modern and safest one, are, of course, for our patients the best. We also focus on more complex procedures with PLA. We discussed yesterday, there were very important questions about combining different products like Juvelook and Juvelook Volume, or Lenisna as we call it in Europe, in one session, for example. Yes, we do it, of course. There is also more interest in fractional techniques, in lasers and radiofrequency devices. As we know, Dr. Seo is a great fan of combining those procedures, polylactic acid and, for example, radiofrequency devices, and we also do the same in Europe. And of course, we observe more interest in body procedures, as we've seen yesterday, due to perfect lecture of Dr. Monika. Our patients' demands are a natural face volumization, a global face volumization, not a single particular places on face to correct. They want, of course, the natural lifting effect. They want improvement of global skin condition. And very important, which is, I suppose, not so common in this part of the world, in Asia and in Korea, a teardrow removal. It's not, I think, as popular procedure here, but in Europe it's one of the most the biggest challenges for us, because Caucasian race is different. We have deep teardrow, very thin skin of the lower eyelid, and visible problems in this area. That's why Juvelook is such popular in Europe right now, because it's a very serious alternative for all other or used before techniques like, for example, cross-linked hyaluronic acid in teardrow, which implements many different problems in future for the patient. We also observe enlarged pores and acne scars, but it's not as such problem as here in Korea. But we observe a lot of cellulite and skin laxity, so we want to reduce it in body injections. As we observe ISAB's survey, it's not the latest one, but it's available right now on the website. There is one very interesting trend that we observe. Increasing amounts of non-fractional skin tightening or non-surgical skin tightening procedures. It gives us a sign that patients are focused not only on botulinum toxin and fillers, but also on something more. there is a trend among patients all over the world that they focus on global skin rejuvenation, and that's why we want to implement Juvalook, or we implemented Juvalook for a few years right now, as a main and basic procedure for global skin rejuvenation for face and neck in European patients. Pterygium deformity. It's the number one right now because it's a really, really big problem and one of the biggest challenges in our European medicine, because it's very popular, it's very common, and it's a very complex problem because there are multiple factors associated with development of pterygium. It's not only a lack of volume. It's a reduction in amount of collagen and elastin, of course, and due to our very thin, extremely thin skin of lower eyelid, we observe also dark circles. Our muscle, orbicularis oculi muscle, is visible through the skin because skin is opaque, and we can observe this muscle and vessels. So we observe a bluish color of the lower eyelid due to a lack of collagen in this area. You of course observe volume of loss in medial orbital area, a descent of the cheek, and global loss of facial volume. Those 4 points are manageable through the injections of Juvalook and Lenisna Juvalook volume, because we can combine those two to get a success in the pterygium deformity management. You of course observe underdevelopment of the infraorbital molar complex. Sometimes patients have a muscular defect between orbicularis oculi and levator labii superioris aliquenasi muscle, and it gives us a very deep groove in this area. Of course, the problem of laxity of orbicularis oculi muscle leading to periorbital fat bulging is not manageable by itself with Juvalook or Lenisna, but it's one of the problems in this area and pterygium deformity. We have, of course, as we see, a lack of subcutaneous fatty layer. So this place gives us the effect of bluish color or reddish color due to visible structures beneath the skin. We have 3 classes of pterygium, of course, as we know. And here comes the 3rd generation collagen stimulator, Juvalook and Lenisna. And this is our protocol for pterygium deformity and lower skin laxity. It's very popular. It's the most popular product right now, or procedure in Poland and in Europe. We use Juvalook diluted usually to 5 mils, or 5 centiliters, and we inject 0.2 milliliter retrograde linear technique with a cannula. It's a very important point. We do not use needle or mesotherapy technique, a classical mesotherapy technique, in the lower eyelid area in European patients because our skin is so thin that nodules are quite common in case of usage of needle injections in this area in Europe. So I advise to use cannula. I usually use 27G cannula. Of course, if there is less experience, I advise to use 25G cannula in this area. Sometimes I do another injections with a very narrow fanning technique in this area, also 0.2 milliliter only. Then I move to another entry point in the lateral part of lower eyelid, and I perform 0.3 centiliter milliliter injections with fanning technique, with cannula, the same cannula, in the subcutaneous layer of lower eyelid. It gives us a very even spread of the substance of the product under the skin, and gives perfect collagen stimulation in this area with avoidance of nodules occurrence in the later time. In some patients we observe a lack of volume in this area, so sometimes I do another shot with a small amount of Juvalook under the muscle in this deep subcutaneous layer to increase the volume of this area with usage of Juvalook. It gives us such effects. Another point, my observation, watching yesterday phenomenal presentations, I think that in Europe, Juvalook Lenisna acts stronger. We don't have to do 3 procedures. There are many patients, we do 1 or 2 Lenisna or Juvalook injections, and that's all. We don't have to do a third session because it's acting, it's stronger in Caucasian race. I don't have a scientific explanation of that. There are no evidence. It's just my observation, clinical observation. But these are patients after 1 or 2 Juvoluk injections. Please spot the patient on the left. The pterygium deformity is, there is no fat transfer in this patient. It's only Juvoluk. The skin tightening is incredible in this area. We get effects similar to fat transfer with only Juvoluk diluted to 5 centiliters. Another point, interesting point, is that we use sterile water for injection. I discussed about dilution a lot with Dr. Sell. And our consideration is that if we use sterile water for injection, there is a bit higher hydration of hyaluronic acid in the vial. So I think this substance is more hydrated, it's a little bit dense, more dense, and it's nicer to inject. It's more smooth. Global skin rejuvenation is an addition for pterygium management. And this is in Poland and in Europe one procedure, because Juvoluk procedure in my country or in Europe globally looks like that we start with lower eyelid and pterygium injections right here, and then we perform a mesotherapy of full face and neck in one session. This is one Juvoluk procedure, and that's why it's very popular in Europe, because it's very complex. It gives us 3 areas: eye area, face area, and neck area in one session. So patient gets really global skin rejuvenation, the full face and neck. So we get increase in collagen production, of course, increase in elastin production, reduction of fine wrinkles, reduction of skin laxity, reduction of acne scars, of course, and enlarged pores. So we dilute, as I said, up to 5 milliliters with sterile water for injections and lidocaine. It's very important to use lidocaine in this case because usage of sterile water only will be very unpleasant for the patient. It will be very painful. And I advise to use mechanical injector to do Juvoluk because it gives us a full control on depth and amount of product injected. I usually work on 1 to 1.6 millimeter depth. It depends on the face and the patient. And the amount of product injected, 20 to 30 microliters per one shot. And area treated is face and neck. For the doctor, for the clinic, it's quite boring procedure because we use a mechanical injector, but it's very comfortable for the patient. It gives a very short downtime, and it gives a low rate of complications. This is my patient. It's only one session of Juvoluk. For pterygium, a full face and neck injections with mesogun. Please focus on the arrows because we can see a very complex effect on the lower eyelid. Crow's feet disappeared. Those wrinkles on the forehead also disappeared, and we have a better effect in the in this area. So this is only one shot, one session, one injection. These are effects of my friend Dr. Kędzia from Poland, and this is another spectacular effect. It's also one procedure of Juvoluk for the neck tightening and neck skin laxity reduction. And this is another patient from my clinic. I want to focus on, it was Juvoluk with full protocol, I mean lower eyelid, pterygium, and the full face and neck. And please focus on the upper eyelid. I didn't do any injections in this area. It's only effect of Juvoluk and the skin tightening of the forehead, and gives us some kind of skin tightening of the upper eyelid and lifting of the upper eyelid without injections in this area. Juvalook is really incredible product. And of course, we have a good outcome in the lower eyelid. This is very interesting film. I want to present it about global facial loss of facial volume. I have to find how to do it. Okay.
Go back and stick.
Right,
You're on top, breathe.
we can lower
Settle
the volume,
in,
please.
abs out, breathe.
This is
Legs
lady.
tight, left arm out, breathe. Squeeze your knees together, breathe. Butt tighter, abs out, breathe. Head back, legs tight, breathe. Knees together, turn me.
Okay, this is lady, a pilot of a jet plane. She's young, 7G force, and she looks. She has all the symptoms of facial loss, volume loss. It's a few seconds and 7G, and we have all the symptoms of facial volume loss. And that's the indication for Juvalook volume, or Lenisna as we call it in Europe. Yes. And this is our new protocol we use in Europe right now. We dilute Lenisna in 5 ml of sterile water for injections, just to mix it in vortex for 30 minutes. Then we withdraw this product to the 20 ml syringe, and we mix it with 2 ml of lidocaine, 1 milliliter of cross-link hyaluronic filler, and we top up to 20 ml with sterile water. And we get 20 ml of incredible substance. We can use it in full face rejuvenation and body rejuvenation, the same dilution. It's very easy. As Monica mentioned yesterday, I'm lazy, so I try to do a procedure, one procedure for all injections, because it's very easy for us and very easy for the beginners, for the doctors who start their journey with aesthetic medicine, and they want something quite easy for the beginning, but it's a very potent procedure. So this is our protocol. We start with cheek injections in deep space, in prezygomatic area, just over the bone in this area. I usually divide this product into 3 milliliter syringes to manage the injected volume easily. And I take 4 3 milliliter syringes for the full face rejuvenation. I mean, 20 milliliters, usually. It depends on the patient, of course. So 3 milliliters is used to do 2-layer injection. The first one is in deep layer of the cheek, and then with the same entry point, lateral entry point over the zygomatic bone, I do the subcutaneous injections with fanning technique, these arrows here, orange arrows, and I do the medial injections, the medial area, from the border of lower eyelid up to the preparotid area, because it's very important for us to increase the amount of collagen in preparotid area, because it gives us a strong lifting effect in the mid-face. Then, with the same entry point, I put cannula up to the brow and do the deep injection to get the brow lift. And then with the same entry point, it's only one entry point so far, I do the temporal injections in the subcutaneous layer to increase the lifting effect in the temporal area, to get brow lift and increased cheek area lifting. Then I move to another entry point in the line with nasolabial fold, the marionette line. And then I perform a deep injection in the top part of the nasolabial fold. Then I move in the subcutaneous layer and do a very narrow fanning technique in the nasolabial fold to increase the volume in this area. Again, with the same lower entry point, I do the marionette line injections. And with the same entry point, because of a difficulty in, if you use cannula with the higher entry point, it's difficult to reach the lowest part of the cheek. So I use the lower entry point and go backwards and upwards to do the injections in the lower part of the cheek. And this is full face rejuvenation with Lenisna, with cross-link hyaluronic acid and Lenisna, of course, or Juvalook volume for full face rejuvenation and lifting. Usually, it takes about 20 to 16 milliliters to do this procedure. We have something left, so we do something for our patient for free. Usually, it's neck injection, because we know extremely good effect of skin tightening in the neck area, so we do 2 areas in one session. This is my patient from a few years ago, only 2 sessions with Lenizna. Without hyaluronic acid, it was old procedure, and we have global volume rebuild and very natural look, and incredibly good skin quality so far. Another patient, very difficult patient. This is that kind of patient. She do a lot of workout, really a lot. I did. Oh, maybe I have to put it here. I did a few micro needle radio frequency sessions with Morpheus 8. I use Morpheus 8 every day, and a multifrax non-ablative laser. And then we decided to increase the volume of phase, of course. And I did only 1 Lenizna injection so far. She's waiting for another one. Another point, the intervals between sessions. In Europe, we use 3 months interval because we observe some complications or overstimulation in patients when we use short periods of time, for example, 1 month. So to be sure and safe, we use 3-month intervals between sessions. And that's another point. We observe a good effect of volumization of the area we did the injections after 3 months. And then we decide if we do second or third injection or session. This is my last patient. Finally, I bought quantifier so I can do the right evaluation of facial volume. It's a new protocol. I mean, it's Lenizna with hyaluronic acid, and this is the tissue drag after 1 injection of Lenizna. Global cheek and lower face lifting, and please focus on the neck. I do 1 entry point on the neck, and this is the effect of the neck lifting after 1 session of Lenizna. We have also combined techniques, because sometimes for our patients, injection of Juvoluk or Lenizna is not enough. They want more. Especially if we do 1 Juvoluk, for example, and our patients see the results, they want something more. So the typical combination is Juvoluk with fractional microneedle radiofrequency. We do not use it in 1 session like Dr. Sell. He's our guru and he's our teacher, but we are not so brave. We want to separate those procedures, so we use Juvoluk, and we do some interval and do radiofrequency. I usually use Morpheus 8, but it's not only 1 device in Europe, of course. A very interesting point is Juvoluk combined with fractional non-ablasive lasers. I use erbium glass and thulium in 1 device. It's from France. It's a new device. And I combine Juvoluk with this procedure. Erbium glass and thulium gives us a good skin quality outcome and a reduction of hyperpigmentation, combined with Juvoluk and increase of amount of collagen, additional amount of collagen. Quite popular is a combination of Juvoluk with botulinum toxin, especially in rosacea, for example, or in to oily skin or hyperhidrosis. There are some patients with hyperhidrosis of the face, and then I put some botulinum toxin to Juvoluk and do the injections with mesogun with this injector to decrease the amount of sweat in this area. Juvoluk with PDO or PLA threads. I use right now PLA, PCL threads, Aptos threads, but all combinations are possible, of course, if we need some more tissue drag or lifting. So, typical indications for fractional techniques combined with Juvelook are acne scars, of course, enlarged pores, skin tightening, stretch marks, and scars. Very good outcome in pterygium deformity or the lower eyelid skin tightening is with Juvelook combined with microneedle radiofrequency. Juvelook with botulinum toxin skin rejuvenation combined with erythema reduction, common technique in patients with rosacea, of course, to control symptoms of rosacea, to decrease the redness of the cheeks. Of course, facial rejuvenation with oily skin and facial rejuvenation with hyperhidrosis in this area. And the combination with threads significantly increased lifting effect, of course. So if we have a very droopy tissue with loss of volume, we can combine lifting with threads, and then we can put a large amount of Lenista to increase the volume and to get similar effects to mini lifts. And of course, another point is increased skin laxity reduction for body procedures, because sometimes Lenista itself isn't so potent to distract the skin, so we need to put something more, and usually this is barbed thread to contract the skin more. Thank you for your attention.
Well, thank you for the informative presentation. So let me summarize the presentation. So just like Korea, and in Europe, fellow face, that can be a great issue. That's why natural look has a great demand. So Korea and Europe have the trend. So when it comes to the Europe and the Middle Asian countries, the laxity goes down dramatically because the skin is very thin. So when HA filler is applied, there can be side effect. So in order to have a natural care and in order to have a natural look, so Juvelook and the Juvelook volume receive great demand and attention. And yesterday, Dr. Monica talked about 20 milliliter dilution. So the Dr. Bartek also talked about 20 milliliter dilution. So dilution is done and in great amount, and also the Juvelook and the needle injector, and that can be done, and energy device can be confined, and the thread can be confined, and there can be combining techniques that can go together with the Juvelook and the Juvelook volume. So let me ask one question. So needle RF, and that can be applied together with the Juvelook. So for rejuvenation, so RF applied together with the Juvelook. So in your personal opinion, needle RF and the Juvelook combination and micro needle injector, between the two, which one is more effective? So could you share your opinion? Which one is more effective?
Well, I think that Juvelook gives better results compared to radio frequency applied only without any other procedures, because we have to do more sessions with radio frequency microneedling to get usually and mainly skin tightening with some amount of collagen stimulated by the energy. In Juvelook case, we get a large amount of collagen and elastin. We know about stem cells activation. We know about fibroblast activation. Yesterday, new lectures about this procedure. So the global skin rejuvenation rate is higher in case of Juvelook. And I think that the contraction of the skin is also slightly better. We use radio frequency with Juvelook, and we treat radio frequency as addition to Juvelook, not Juvelook as addition to radio frequency. Juvelook is more important for us comparing to radio frequency. But sometimes we need to add some more contraction, especially for the body areas. And that's why we use radiofrequency to increase the contraction effect.
그 주베록을
And you are using the Juvelook, the dilution is a 5 cc. And if it can be used within the needle injector, the injection is easy enough? That's my question.
I usually use 32G or 34G needles for Juvelook in this dilution, but sometimes 34G needles get clogged in the injector. So usually my typical setting for the Juvelook injections is 32G needles in the injector, and I use one cartridge for one patient, so it's very easy to implement and use. Sometimes, if one combination more, I didn't mention about this right here today in the presentation, but I also, if we have a patient, for example, after a holiday, after sun exposure, I combine Juvelook with non-cross-linked hyaluronic acid, a quite large amount of non-cross-linked hyaluronic acid, to increase the hydration of the tissue, for example, after the sun exposure when skin is very dried. It's another combination.
그 저희 나라
So in Korea, and actually we do more dilutions, the needle injection done in the dummies, and in the past 6 cc, now 8 cc, and well now we actually have the twice the more dilutions, and we do more injection with more dilutions. That is a practice in Korea. So actually, more needling can be done if you do not have a high many patient. Any questions from the floor? Well, thank you for the great presentation. I have one question. So hyperhidrosis, so toxin and the Juvelook can go together. You do hydrolysis. Actually, toxin itself has the benefits, but when you add the Juvelook, do you have an additional benefit? That is my question. Do you have additional benefit?
No, of course not. Unfortunately, in this case, Juvelook doesn't act for decrease of hyperhidrosis, but I combine those two substances if you want to get both effects. I mean, skin rejuvenation and hyperhidrosis treatment in this area. So that's why I combine those two substances.
Thank you.
So my name is Sue Becker-Weidmann. I'm a dermatologist from Germany, and I noticed the difference between the dilution of the products in Korea and in Europe. In Korea, the doctors use a normal saline, while we use in Europe distilled water. Do you know the background? Why?
Yes, of course. Yes, we had a lot of discussions, Dr. Sell, my friend. So we discussed how to dilute it in the best way, how to increase the hydration of hyaluronic acid, and that's why I decided to use sterile water for injection for Europe, because we get more results. I think maybe that's why we have to do some papers together, maybe some comparative studies, Korea and Europe, to do the dilution techniques comparison, because we use not normal saline. Normal saline is in Europe advised to use in case of allergy to local anesthetics. So if a patient is allergic to local anesthetics, we cannot combine water with lidocaine, and we use normal saline instead. So it's some kind of history of implementing Juvelook and Lenisna in the European market. I had a long journey to implement this product in European market, because we had a different information from Korea for the beginning, because they also experimented with dilution, and they used normal saline and water. There is a paper about water and other techniques for dilution on PDLA products. So we based on some scientific data, and we decided to start with water to get best results. Maybe that's why in Europe we had such perfect results, or maybe it's just a point of our difference between our tissues, the response of skin in European market and Korean market.
Thank you. I have another question. You said you didn't use the the Juvelook product on the upper lid. Would you recommend to use Juvelook because you showed us a case of rejuvenation of upper eyelid, even if you didn't use it?
Yes, of course. It was a side effect in case of this patient, because I did just a typical Juvelook procedure. I mean, mesotherapy for full face and the lower eyelid, and this lifting of the upper eyelid due to the contraction of the skin of the forehead occurred, so that's why we observed the lifting of the upper eyelid. Yes, we can do injections in the upper eyelid, but we have no such experience. There are not a lot of patients injected with upper eyelid with Juvelook, so maybe we can start cooperation and do some papers on that.
Okay, thank you.
Thank you.
네,
So we are behind the schedule. So, well, we are going to have about 1 hour panel discussion, so we can accommodate more questions during panel discussion. So please give big hands to Dr. Batek. Thank you for your presentation. So now we are going to have a panel discussion. So now we are going to invite the panelists up to the stage. So the Dr. Batek and Dr. Yoon wonderfully lead this session. Please give a big hand one more time. So we have the delay. So without coffee break, we are going to start the panel discussion once the stage is set. So we had a late start, and also there will be the great discussions. And there can be some delay in our discussion, so we ask a hotel to delay the checkout time as well. So you will have the delayed checkout. You can have a late checkout because we already talked about that to the hotel. So once stage is set, we are going to start the panel discussion.
네, 곧 패널
So soon we are going to start the panel discussion. Panelists, please come up to the stage.
네, 그러면은 바로
Then we are going to begin panel discussion. So yesterday we had the great discussion. So doctors shared their secret recipe about Juvelook volume, and today we are going to have discussions about Juvelook. So unlocking the secret will be shared in this session. Dr. Yoon will serve as moderator once again for this session. So the Dr. Yoon was introduced earlier, so without introducing him, we are going to introduce the panelists. So let me give a microphone to Dr. Yoon. So, well, I will continue to act as a moderator for this panel discussion. And we had a preliminary meeting and had a discussions about this panel discussion. And when we have heated discussions, and we can cover other topics as well. But anyhow, let me introduce a panelist, Dr. Park Ju-hyuk from The Hill, and the second, the Dr. Jung Sung-gyu from Doctors. So please give a big hands to welcome them. And we also have Dr. Lee Han-hol from Lee & Lee Plastic Surgery, and Dr. Shim Hyun-chul from the Cell Dermatology. And last but not least, we have Dr. Batek, who wonderfully delivered a great presentation. So just like yesterday, we are going to have a 5-minute case presentation. And after that, we are going to have a Q&A session. So Dr. Park first.
네, 안녕하세요. 저는 더힐 피부과 박주혁 원장.
I'm Park Ju-hyuk from The Hill.
간단하게 좀
Well, let me do the case review first. So regarding the Juverug, and well, many of you have a great case, so I'd like to share a unique case here. So this is the scar case. In order to cure that, Juverug has been used for many times. So the acne and the redness, and in order to improve that, the Juverug is applied. And as for the pigmentations, Juverug can give a great benefit as well. So this and the Juverug can have the great applications. When it comes to the diabetic cases, there are traumas and without the unknown reasons. And we actually have a great these scar cases, and the Juverug can apply that. So this is the actual case. And I do not have many such cases, so there are limited number of photos. So I have a great satisfaction after using Juverug in this case, and also patient have a great satisfactions. But number of diabetic case has been limited, so I do not have many photos. But anyhow, the result is quite beneficial. So when it comes to the diabetic case, there are great redness, and also wound healing is not easy. But by applying Juverug, this redness can be reduced in dramatic manner, and also the normal the tissue can grow. So that is my observations. I do not have many such cases. There are limited cases. So in your the clinical these settings, you can consider this the application of Juverug as well. This is a second case. This is a full head augmentations. So Juverug volume is applied for full head, and this is similar to other cases. And I want to introduce a full head case. The Juverug volume is wonderfully applied on full head. That is my belief. So the patient and the doctors do not use the fillers anymore, so the Juverug can replace the fillers. That's why I apply Juverug on full head in intensive way. So my clinic was heavily used the PLA products and the PLLA and the PDLLA products. And the Juverug volume can be highly recommended on the full head. So you might understand that, but in very easy manner, the Juverug can apply this one. So in this case, the Juverug volume 5 cc was applied and the 3 sessions for this patient, and the natural look was realized. So there was greater satisfaction. The 10 cc on temple, so natural lifting was achieved. So the amount has been increased a bit when you applied this, and we can have the filler effect, but natural looking. Thank you. So Dr. Bach introduced the full head case, the temple case, and also the scar case. As for scar, Juvaruk has a great benefit, and many people understand the Juvaruk's benefit on scar. But about some use Juvaruk, some use Juvaruk volume, and some do subcisions, and while some do bolus injections. And what is your methodology? So Juvaruk and the Juvaruk volume application of the two can be different in my case. And as for the Juvaruk, as you mentioned, and that they can be used for scar. So subcision can be done in this case. As for the Juvaruk volume, so doctors have a different opinion. But in my case, and I use Juvaruk volume just like a filler. Just like a filler means, and you do less dilutions. Well, that is quite complicated. I use the filler intensively. As for the Juvaruk volume, the amount can be different between the Juvaruk volume and the fillers. Even though I inject a certain amount of Juvaruk volumes, and I sometimes cannot achieve the expected result. And there are some worries from patient about the nodules as well, but forehead and also the marionette lines and the front cheeks, and case by case the amount can be different, but I have a minimum guidelines. So the Dr. Chung Sung-gyu, when we have a meeting, and you actually briefly mentioned about scar. So could you share your opinion about scar case? So LZ is used. So the Curazet, the LZ is used. The subcision is done, and a Juvaruk particle can be injected in the middle. That is a fibrotic tissues. If we do if we do the injections without any subcisions, there can be some issues. So air jet is applied. So I'd like to ask one question. So as for the forehead, so the volumization should be done in accurate manner. So I also do many forehead procedures. So there can be complaints if we have the problems regarding forehead. So, for example, filler 1 cc in order to realize that how much the Juvaruk volume is used. So that is not quite clear cut. So as I mentioned, it is quite difficult to expect exact the outcomes as for the Juvaruk volumes. So in order to have the round and volumized the forehead, it is difficult to have the PLA. So it is precision and the procedures. In order to realize that, it is difficult only to rely on the Juvaruk volumes. So in the case, filler can be recommended, and also thread can be recommended. In order to use Juvaruk volumes, there should be the prior consent from the patient. So if there is an agreement from patient, there can be good dissatisfactions. But anyhow, when it comes to the precision and the procedures, it is difficult to realize that with the Juvaruk volume. But anyhow, we can give some volumization effect. So when it comes to the forehead, the volumization can be bad, and how you can increase satisfaction of a patient in the case. And when I see the recent trend, so recently there are some objections about the fillers. So the female patient, they do not have the filler procedures. So actually the image of a filler, that is quite negative. now. And in the past, we recommended a filler. But when patient comes for volumization on the forehead, well, we recommended a filler, but not these days. If I recommend filler, so patient are quite reluctant to accept that one, even though I give good the recommendations because of negative image about filler. There are high rejection cases. So true volume is recommended first, and if the patient want to have immediate the outcomes, then I recommend filler. So true volume is recommended first. So this is my approach, and my patient have a great satisfaction on my approach. That's why I recommend the volume first, and after that, the filler is recommended if they want to have an immediate outcome. So by using Jubaruk volumes, and volumization can be done, but that cannot be done in precise manner. So, well, we cannot realize great volumization with the Jubaruk volumes. How about Dr. Ianor? How do you handle full head case? So Jubaruk volume use and over again, there can be accumulated effect. So, well, based on this accumulated effect, we can have a filler-like effect. I do not have many cases, but when I see 5 or 6 cases, volume effect, volumization is quite good with volume, Jubaruk volume, so I will do more. So actually, you are doing that intensively. So how do you see the texture changes after using Juvaruk volume? Volume and the texture changes. So after repeated procedures, so what kind of changes you can see? The Juvaruk volume and the Juvaruk, when those are used, so depending on the layer, depending on the depths of a layer, things, the result can be different. But anyhow, let me share my experience when I do procedures. So everything is not quite clear, but I believe isolation is important. So following by the reaction is taking place. So without a nodule degeneration, isolation should be done. So granuloma should be avoided and the nodule should be avoided. But still, and we should have good techniques. I do not do defending all the time. As for the forehead, I do not recommend Juvaruk volume. If I do Juvaruk volume, we should do the massage after the procedures. Then there can be movement of substance, so we cannot have expected volumizations. So isolation, if isolation is done in good manner, there can be high satisfactions. If there is great demand for the volumizations, isolation, that is great, but it is important to prevent nodule. So I have the shallow injections. So when I do shallow injection, the energy device and the EVD can be done. So, well, the spread should be done. Otherwise, the nodule irregularity occurs. So after the Zuvaruk procedures, energy device can be applied. And also, if there are some irregularities, even after 5 days, massage should be done. That is my recommendations. So the massage soon after injection, that can give damages on skin. So when it comes to Juvaruk, so it is important to have a shallow injections and without any the massages. Well, there was no nodal case. So for the skin texture, it is important to have a shallow injection. That is my way. I do manual injections. So Dr. Batek, So 1.2 and 1.6 depth methodotherapy. So you mentioned that. So, actually, Dr. Lee talked about shallow injections when it comes to Juvarug, and what will be proper depths?
We observe the more shallow injections in Europe, the higher risk of nodules. This is our observation. So that's why we go a little bit deeper, deep intradermally, to get a good result of collagen and elastin stimulation with avoidance of nodule formation. Maybe a new strategy is to increase the dilution, and in case of shallow injections to use, for example, Mirajet. That's our idea to implement this device, because it allows us to give a very low amount in the shallow level, because the two safety issues or manners I want to mention. The more particle separation in the product, the less risk of nodule formation. That's why we use such high dilution of Lenisna, because and we combine it with hyaluronic acid. It gives us a perfect particles separation in the product, and it gives us the stability of the product, a perfect stability. So we keep the particles separated in the long period of time after the injection. That was the problem with Sculptra. Yes, when we had sedimentation of particles even in the tissue, and that's one of the risks of nodule formation or granulomas. That's when we use the combination of high dilution and hyaluronic acid, crossing hyaluronic acid addition, we lowered the risk of nodules in case of Lenistain, deep injections. In case of Juvaluk, the injector gives us also a quite low amount of product in one shot. Usually we have 9 needles. It depends on the product or device, sometimes 5 needles, and we inject 20 to 30 microliters per one shot with 9 needles, for example. So we have 5 microliters per one needle or less. So we have a very small amount for one shot, and this gives us a high level of safety and very low risk of nodule formation. Another point I want to focus is a new idea by Kotofana, is that the risk of nodules or granulomas increases when we unintentionally add or inject into this mass, I mean in the layer of the fibrotic tissue. So it probably increases the risk of nodule formation. That's why the cannula, work with cannula is the layer control. So if we improve our skills and if we control layer perfectly, we can avoid serious complications like nodules formations. Yeah, thank you.
So actually, I want you to ask a common question. So the vascular oxidant is one concern. We cannot eliminate the vascular oxidant, but Juvarug is relatively free from vascular oxidants. So yesterday and today we have the worries about nodule. So in your clinic, I think you have a know-how to reduce nodule. So could you share your secret to reduce nodule? So the PLA is heavily used in my clinic. So in my case, I have no nodule case. So when it comes to the PCL, there was 2 nodule cases. So the hydrations and that is important. And also the preparation time is important as well. And after injection, some patients raise questions about nodule, and there are great anxiety in the patient. So hydration is crucial. And also it is important to have thorough explanations. So nodule case can be reduced, and the patient worry about nodule can be reduced by providing thorough explanations. So as for lateral cheek and the forehead, and as for the injections, and well, if we do the volumizations, and well, it is important to have the filling of the internal tissues in order to reduce nodule. Any secret? So the 333-555, and that was recommended in Sculptra. Actually, I emphasize the importance of massage as well. Some doctors say the massage is not that important, and I also have a similar doubt. But anyhow, when I see the patient, and well, it is important to give some well things for patient to do. So well, this can be patient and the responsibility somewhat. So, well, when we recommend massages and when there is a nodule case, the patient might think that is because of a lack of a massage they did. So this might be transferable responsibility, but anyhow, how about Dr. Zhang? So I'm going to mention that one in my short presentation, so I like to briefly just talk that. So I believe the nodule is an unlucky draw, and we do lucky draw after lecture, and the nodule is an unlucky draw, so that is a random. So when we see the nodule, it's not because of wrong injections, and because of immune reactions, and in unfortunate the situation, nodule can happen. So because of overreactions, the granuloma can occur. So, well, even though very experienced doctor do the injections, the doctor cannot avoid that. That is because of overreaction in the body. So nobody can avoid that one. How about Dr. Lee? When I also introduced that case in my presentation, so when nodule occurs, so well, that was a pretty high concentrations, and also there was the change of layer. That's why there was the nodule. So now I want to go for the deeper layer. In the shallow layer, there can be nodule. So how about you? So nodule. Well, as for the Jubaruk, I do not have a great worry about nodule. And yesterday, Park Jae-young shared his experience. And while temperature can go up, and also we can give some the massages. Well, so nodule does not have a great the issues with Jubaruk. The problem can be granuloma. That can be the case. Granuloma can happen. So a few years ago, when the Juvarug and Juvarug volume was first introduced, there was a saying that there is no case of a granuloma. But granuloma can happen, and in particular on the eye area. So it is important to reduce the nodule risk and granuloma risk. So as for the Juvarug, it is important to have a proper layer injections, proper amount and a proper layer. That is important, and also proper massage is important as well. Yesterday, Dr. Bach said, so the under eye area is a thin area and also movable area. So when cannula is used, and actually while the fluid move to the low dense area, so Juvarug volume is injected on the eye area, there is the certain amount of the amount on the eye area can accommodate, but we sometimes use excessive amount. That's why the fluid moves, and also nodules and granuloma can occur. So I'm going to explain that one in my presentation. So the principle is a 777 massage guideline is given to my patient. For the under eye area, in this area, without the great massages, we cannot see the nodule issues. So there are the space, so the fluid can move to the additional space. So as for the under eye area, even though we do fanning, there is a limited space. That's why there can be nodule cases, so isolations and nodules, and there can be high risk. That's why I recommend the massages for under eye area. So when you do massages, so as we wash the clothes in the the pen, and we give great force. So if we do the massage on the eye area, we should do in the proper manner, but the massage cannot be done just like our the expectations. So on the periorbital area there is bone, so the massage should be done to give enough force. So the orbital bone that should be used in order to do proper the massages. But some patient they do too much massages, so the vessels can broken. So that can be another problem. So that can give the swelling. So this swelling they go away within 1 week. But anyhow, there can be some the vessel the bursting issues. So if proper massage is given, there can be no nodule, and also it is important to give a proper amount. So how about Batek? So Dr. Batek, well, any secret to reduce the side effect?
Of course, as I mentioned, layer control and amount control, especially in the lower eyelid area, we do not advise to do the massage at home. But after the injection, immediately after injection in the Juve-Look protocol under the eyelid, so in third row area and lower eyelid, I advise to do a massage just after the fanning technique to evenly distribute the product in this area. So this decreases the amount of risk of nodules. Another point, our observations are that if some doctors decided to go on their own and do needle injections in the lower eyelid in Europe, we observed some nodules, not granulomas, of course, but nodules in short period of time, probably due to too shallow injections or too big amount of Juve-Look injected in one spot. How to manage it? Because it's not a very common problem, but sometimes it occurs in Europe. First point, avoid patients with autoimmune diseases. It's contraindication for collagen stimulators. In my opinion, because main problems with Lenisna, some kind of excessive response for the collagen stimulator occurred in patients with autoimmune history. Another point is if we observe a nodule, we start with normal saline or IPRF, platelet-rich fibrin injections straight into this nodule. Another strategy is to use radio frequency to increase the temperature in this area up to about 41, 42 degrees centigrade, and then do the very strong massage. This massage is very important because we lower the viscosity and density of the product, and we can spread it back and evenly distribute this nodule, because sometimes there is some point of concentration of particles of Juve-Look in this area. And another point, the last chance for us, or two last chances, if we have problem with nodule, we inject a low amount of steroids, long-lasting steroids, for Depomedrol, for example, straight into the nodule. And we can also try to use collagenase in this area to decrease this nodule if it's still visible, despite using normal cell injections or radiofrequency. So that's the secret. Thank you.
So let me summarize the proper layer and the proper amount, and that is the key. So the cannula can be used, and the substance should be spread in proper manner. But the nodule can still happen in the case, as Dr. Bartek mentioned, RF device and other normal cell injection can be done, and the steroid injection can be last resort. But still, we can consider that. And if we still have the issue, and also 777 347 can be applied. That might be too much, but it is proper to give that kind of explanation to patient. So when we see the clinic these settings, even though we give the massage guidelines, and patient just press the fingers on the under eye area. Of course, we should avoid bruising, but still, it is important to give a proper massage guideline. That is a summary. So let's move to the Dr. Zhang's case.
해드리겠습니다.
Dr. Zhang, 5 minutes. And nasolabial crease correction is my case. And there can be sharp nasolabial fold crease. So how we can use Jubeluk is my case. And we are talking about nodule right now. And within the Korean conferences, I gave lots of lectures about the nodules. So I'm going to tell you about my technique, how to prevent and correct nodules. So how do you treat the nasolabial crease? This is my technique. I'm use the 33G syringe and the 4mm short needle. Superficial injection is made. 0.02 to 0.03 milliliter is used per 1 point. The total is 0.5 to 0.7 milliliter. And 8 milliliter SWFI dilution is used. And I have the non-cross-linking HA mix. Sometimes I use lidocaine if patients are afraid of the pain. And just following the nasolabial crease, intradermal injection is made. And it is done within the 20 to 30 seconds per side. When you take a look at the outcome, just with the Jubeluk 3 cycle, 10 weeks after that, and you can see the sharp wrinkle has been corrected. You can compare the left and the right before and after the procedure. Patients say, and I do not have any cosmetics getting into my crease. And she has some crease even to the lip side. The treatment is the same. Of course, I need to use more substances with the Jubeluk 3 cycles, as you can see. Even though the outcome is dramatic, but actually it is dramatic. What I'm saying is the patient satisfaction level is high, even though visibly it might not be that dramatic. This patient came to me for the last 3 years. I didn't know about her complaint about nasolabial fold, and Jubeluk is an emerging product. Recently, we used the RF, other volumizing effect treatment, and I realized that she can be the right indication for the Jubeluk. So I used the Potenza pumping tip with a manual injection. The nasolabial fold has not been improved, however, just with monotherapy of Jubeluk, and she got much better. So her nasolabial fold has become much better. She was satisfied because the cosmetic product does not get into the sharp crease. And she has fine wrinkles, as you can see. And with the 2 cycles of the Jubeluk procedure, and you can see after 4 weeks, she got much better. Sharp wrinkle can be key indication for the Jubeluk. RF might not be the good methodology to use just with the energy device, especially for the sharp wrinkle on the nasolabial fold. However, if you inject the filler into too deep, there can be migration. If you have the shallow injection, there can be nodule with the fillers. However, with the Jubeluk, you have relatively less migration, relatively less side effect, and the sharp wrinkle on the nasolabial fold can be improved. However, there can be some side effects like edema, erythema, bruising, and infection. However, nodule is always an issue. Nodule control is not that easy. Of course, prevention of the nodule is really important. My principle is wait and see. You should do it. Wait and see. And let me tell you the time flow, how to wait and see. Prevention is really important. Overcorrection can be an issue. Please avoid overcorrection. And enough dilution is really important, 8 to 10 milliliter. And 1 point injection amount is really important. When you are using Juveluc volume, you should be really careful initially. But if you become really competent after 1,000 cases, you feel like you are the god and you feel overly confident and the amount of injection increases significantly. Don't be too confident about it. And after 1 month, the patient might be suffering from complications. 0.1 milliliter is a really small amount. Small amount, even distribution is really important when you are doing the augmentation. And when the patient has the hyperdynamic and the thin skin, you should be really careful. For example, lower eyelid and the chin and forehead, you should be really careful. You should consider the skin type and the skin nature of the patient, especially on the lower eyelid, and you should get into deeper, like a subdermal. And you should be really careful when you're using the Juveluc volume. Yes, nodule can happen. It is not a problem related to Juveluc itself. It's more like related to when you are using too much of Juveluc. If you are using the Juveluc, following the right procedure, following the right protocol, you are less likely to have a nodule. Reassurance, observation, oral medication can be the easiest way to treat the nodule. On the right side, you can see injection, excision, or using the machine, but they can be the burden to you, I mean to doctors. Between these two, you should make a choice. First, the time, I mean the onset is really important. The earlier stage nodules are like a physical conglomeration. In that case, massage or RF can be used in the early stage when there are visible symptoms or when there are some reddish symptoms. In that case, you should analyze more and more. If there is no symptom, you should wait and see. Personal trait is really important. The patient's nature is really important. When the patients are really complaining hard, you should do some action. For example, normal saline, RF, or the injection can be the first choice. This is how you should manage the nodule. Assessment is the first step, whether that is a real nodule or not. Sometimes patients come, they touch their teeth, and they claim it is the nodule. And I tell them, do not touch your teeth and tell me it is a nodule. And in some insertion point, there can be some kind of nodule formation. And sometimes you need to have a clear assessment whether it is a simple muscle contraction or is it a nodule. The second step is the symptom assessment. If there is no visible symptom, you can do the observation just to wait and see. 80 to 90% will be gone as time goes by. It's about Scotra. But when you have the visible nodule and when there is a symptom, you should do some intervention. When there are some infection signs, oral medication can be used to subside the symptom. And if that's the early stage of the nodule, in that case, that can be the physical conglomeration. In that case, as I told you, by using the RF or NS injection can be used so that you can lower the concentration level. My question is, when you have the RF, you can make it soft because the glass transition temperature is really low for the Jubaluk. However, when nodule is formated, it is highly unlikely that the particles are conglomerated together. And sometimes it can be the outcome of cell proliferation. Probably it cannot be resolved simply by increasing the temperature. Glass transition temperature is low in Jubalu. Yes, that's a benefit. One means if we use the RF, the temperature can be 60 degrees Celsius. In that case, it can have negative impact on your substance. So the glass transition temperature is something to be really considered in a careful manner, I mean in the future. In a nutshell, Jubaluk can be used along with the non-cross-linked HA, then the outcome for the nasolabial fold correction and sharp crease can be really good. For the nodule management, in the early stage, we should take some physical intervention. And if that is on the cell proliferation, you should wait and see. That is my conclusion based on my discussion with lots of experts. But again, this is my personal opinion. I do not have lots of evidence on this. This is just based on my experience. That's it from me. Thank you very much. Dr. Zhang, thank you for showing a great indication. And also, you have a great procedure or the algorithm that we can refer to for the nodule management. On your slide, it is 0.1 cc per point. (0.02 or 0.03). So I have 20 times of the injection. 0.5 is used on the one side, and on the other side, yes, the remaining amount can be used. 1 point injection is 0.02 or 0.03, not 0.1. I tried this one. I used the 3,4G needle. The injection was working. And after 2 to 3 weeks of the follow-up, patient started to showing some good outcome. And many other doctors use the subcutaneous injection of the Jubaluk volume, and that kind of combination can be good. Yes, I'm doing that a lot. And next time, when I have the opportunity, I can tell you about the combination therapy of the Jubaluk volume and the Jubaluk at the same time. It depends on the structure of the nasolabial fold. And if the volume is really reduced, in that case, subcutaneous Lenisna engagement can be done. And Jubaluk can be injected on the intradermal following the crease. And probably that kind of combination is really widely known, and I'm doing that on the same day. Thank you. Thank you, Dr. Zhang. Let's move on to Dr. Lee.
Hello, I'm Lee Hanol. So, when it comes to the lower eyelid issues, there can be various measures. So the fat at the grafting is done, but by using Juberug, I can do some additional benefits. So I'd like to share my experience. And yesterday and today, many doctors share their secret recipe. So Juberug was the main dish, but in my case, Juberug is not main dish. Juberug is a side dish, but Juberug still is a great side dish, which provides great support for the main dish. So this is a dissection images. So the anatomy is quite different, point by point. So here the skin is thin, and as you go here, thick, and the fat is the small amount here, and as you go down, the fat increase. So in order to solve under eyelid issues, fat the grafting is done. So, well, actually, dark circle issues, the intensified as time goes. So the fat grafting is done, and in my case, collagenase is done. So cell unit graft is the name I use for this practice. So the microfat can be compared to graft, and also well, we have special structures in order to have the better outcomes. Anatomy structure is different. That's why we apply different methodologies. So here there is a muscle and microfat that can be go into this just like the stacking and the grave. So this is a concave type. In order to make a convex, if a volume is not enough, then additional fat can be grafted. So 29-year-old patient, so the swelling has gone and the overall satisfaction was good. But when it comes to this line, well, there is quite a sharp wrinkle here. So as we fold the hand, there can be the wrinkles. So when we fold our wrist, there is a wrinkle. The same kind of a wrinkle can be found on the eye area. So in order to solve that one, after the fat grafting, Juvarug was used. So on the dermal layer, Juvarug was injected in this patient case. So when Juvarug is injected, I could see great improvement of skin. So cannula is used. The sub-Q was the target layer, and the dermal layer was also targeted as well. So when we do Juvarug injections, and that can do the beneficial the effect. So when we use the Juvarug together, so we can have a very strong solid structure. So these are the actual cases. So the Juvarug volume used together with the fat grafting. So as you can see, engraftment is great. So Juvarug is used in this case as well. And well, the vessels are quite visible. I cannot properly use this the pointing device. So on the left bottom side, you can see the visible vessel, but that has been improved much. So scaffold function can be visible, and also skin tightening can be realized by using Juvaruk. So those are the benefit of Juvaruk we witnessed. So this is another case on the right. The bottom case, you can see the issues. So the PLH was improved, and also the fat grafting was done as well. Not only female and the male patient have a good outcome as well. So this is an allergic case. So there was quite a severe skin damages. So the fat rearrangement and the grafting was done. And as for the underlid area, there was improvement, but there was still the wrinkle issues. So laxity was pretty severe. That's why on the eyelid, the procedures was recommended. But she has some fear about the operations. And here, because of the sunken and the effect, the satisfaction was not very high. That's why I consider the combination with the Juvaruk. So the volumization was good, and texture has been improved, and dark circle issue has been reduced as well. That was the benefit I witnessed with the Juvaruk. This is a quite interesting case. So she came to my clinic because of a dark circle, and the fat and the grafting was done, and the Juvaruk was used in very aggressive manner. So the abdomic issue has been improved as well. So, because of great improvement, the other, the site, the existing site was more visible. So that was a quite kind of, happy complaints. And I first recommended operations, but she is in her 40, so she didn't want to do the operation. So Juvaruk was applied, and the Juvaruk gave the effect just like an operation. Under eyelid operation effect was realized here. But as for this severe case, operation should be done. But this particular patient didn't want to do the operation. So I did underlid operation and also applied the Juvaruk. So this is quite a remarkable outcome. Satisfaction was good. So she actually regretted she should have done the operation first. This is a dramatic improvement of wrinkles. So on the eye operation can reduce the wrinkle issues, and also Juvaruk can improve fine wrinkle issues. So those can go together. Operation and Juvaruk can go together. But the problem is a nodule. So I had quite a good the outcomes initially. That's why I did excessive injections and had a nodule case. And after experiencing nodule, I had more dilutions and also reduced the injected amount. And with that, I could reduce nodule risk. So when Juvaruk volume is used, engraftment can increase. The problem is, and that can be too much in case. So this can be some excessive the outcomes. So the engraftment was pretty good in this case, and skin texture has been improved. So this the under eye area has been and the traumatic transformations. But actually, the existing problem were very visible, so that was a complaint from patient. So it is important to have a proper warning before the procedures. So fat grafting can be done together with Juvaruk, so they can have a great the outcomes. Juvaruk is the side dish, but that can greatly support the main dish. Thank you. So the fat grafting is done together with Juvaruk because he is from the plastic surgery clinic. So what is the challenging is the bruising can be quite a serious case. So could we can make changes just with the Juvaruk, but he did Juvaruk together with the fat grafting. So fat transplantations. So you can do just one and the operations. But laxity can go down, so the Juvaruk volume and the Juvaruk can apply it repetitive manner. So if the outcome is good, the patient doesn't come back. But when patient come back, that is the complaint case. So when patient has satisfactions in the plastic surgery case, they do not come back. So, compared to dermatology clinics, the satisfaction rate is pretty high. So, we have just one and these sessions because as for the plastic surgery clinics, there is very rare second and the third sessions. So there can be the additional visits in the case they want to have some additional decisions. And there is a quite a rare revisit case as for the plastic surgery. So the satisfaction is pretty high in the plastic surgery case. So there can be very low revisit case. So you use the fat transplantations and the Juvaruk together. And when it comes to intravital and on the mala area, and you can do the fat rearrangement in a wonderful manner.
김현철 원장님.
Last but not least, Dr. Shim. I prepared 4 to 5 slides, literally, because I was asked to do that. The main indication of the Jubalog and Jubalog indication can be this one, especially for the skin boosting. I personally do not use PN Botox, and I do not think it's going to have a really skin boosting effect. So I usually like a manual injection rather than using the injector. I usually prefer manual injection. For acne scar correction can be usual indication. The downtime should be minimal. When you are using the fractional razor, after 3 to 6 months, even though the follow-up is really satisfactory, patient should say, I want to have a downtime. But the scar cannot be corrected just with 2 to 3 procedures. Long-term procedure is really important, so downtime should be minimized. There are many scar patients who are aged. The aged scar patients who had the acne scar do not want to have a patch on their skin. But for me, I make them wash their face on day 1 and they can wear the makeup on day 1. The downtime is minimal, so patients can continue their treatment. So the scar improvement and the scar outcome is really good. The first case is about the acne scar. There is another case, the traumatic scar. When I'm using Jubaluk, I use 29G with a long needle. When I use 30G, for me, 29G Dissection is much easier. On the scar tissue, they are very tight. If the needle is too small, the dissection cannot be made fully. Sometimes I use the air dissector in the case of the acne scar to create some space. But if you have the bulging effect, in that case, a scar can be hidden. Sometimes, at the point of injection, you do not know where to inject. So, air dissect is not always recommended. For this kind of the traumatic scar, I used 29Z and I have some internal dissection. And when the tissue is really fibrotic, we should avoid that area. So anyway, I used 29G for dissection and injection is made. The dissection was working and the injection was working. When I'm using the Juveloc, I use that kind of technique. For the Juveloc volume, I use 26G. I have to. So for this scar, Juveloc volume can have a deeper approach. And on the shallow, and you can have Juveloc only. And these days, I usually use Juveloc only. This is another case. On the left side, the patient was going through lots of the scar treatment. The skin barrier is almost gone because the patient was going many times of the procedure for the scar treatment. If I'm just applying the conservative scar treatment, the patient will complain me, my skin is getting thinner. So in this case, rather than using conventional technique, I can use Juveloc. As was in the previous case, in the case of the nasolabial fold on the floor when there is a sharp crease, in that case, yes, I can use the Juveloc. When I am giving the treatment for the scar, I sometimes give treatment to the crease because by doing that, you can make patients satisfied. You give the scar treatment and you reduce the crease and wrinkle at the same time. They can make your patients satisfied. Juveloc can have less downtime, and Juveloc has an indication not only for the scar but also for the crease correction, and the skin quality will get better, especially for those patients whose skin barrier is really weak. Juveloc can be a good treatment that you can use. For this kind of rolling scar, yes, this can be really difficult. But after the introduction of the Juveloc, whenever I have a patient with the rolling scar, I can simply use Juveloc. And we can be more confident and aggressive using Juveloc for the rolling scar. And for this kind of scar patients, and you can minimize the downtime and you can use the Juveloc rather than using the laser. So what matters is to minimize the complaints from patients. In that case, Juveloc can be a really good approach we can make. Traumatic scar can be good indication too. And there are some patients who are coming to us simply because of they want to remove the incision mark, especially after the plastic surgery. They want to remove the reddish part, and I can use the laser and along with the Juveloc. In that case, the outcome can be really great. For the upper eyelid, I sometimes use Juveloc. When the patient has the double eyelid surgery, the patients come with the incision mark. Yes, it can be sometimes very challenging, but with the Juba look, as long as I do not have the nodule, I have the isolation technique and I use small amount of the Juba look on the upper eyelid for the double eyelid surgery incision point. And in that case, I was not suffering from any nodule. And of course, I use the laser as a combination therapy because the energy level of the laser is not that high, so I usually do not have the complications. In the scar treatment, Jubaluk should target dermis. And even though when you are using the bevel up with the manual injection, yes, you can go as deep as the dermis. It is highly likely you cannot target deeper than that. So, for me, I'm trying to go as shallow as possible. I use 29G for Jubaluk, 26G for the Jubaluk volume. The Jubaluk volume cannot go shallow. So for me, this is the technique I use. Especially for the scar treatment and the pore treatment, I use needle because I need to target the shallow layer. As for the volumization, of course, we are not talking about the Jubaluk volume, but the nasolabial fold and palpebral mala groove. They have lots of the demand. However, you should be careful about this area. As Dr. Patek said, and Jubaluk can be working like a basic foundation or the scaffold. And I'm not just targeting lower eyelid. And when I have a global facial rejuvenation, I can target lower eyelid as well. And when I use the Jubaluk volume, I use the hydration well before the treatment, well before the procedure. Lower eyelid can have the nodule when you do not give the massage, when to apply too much of the amount. In that case, there can be some nodule. The massage training is really important. And there are some patients who have the loose tissue, and sometimes there are people with dense tissue. So you should assess that kind of tissue density really carefully. And massage training is also really important. When you are injecting, the amount should be really carefully designed. And after the first injection, based on the threshold you personally designate, it should be always below the amount that is going or that is flowing to other area. And again, the massage training using the orbital rim is really important. And there are some patients who are coming because of the complaints in the dark circle or the pterotrope. And in that case, I use the volumizer for the lid check. That's it from me. We are well delayed. My question was Jubaluk and the Jubaluk volume when you are using them to scar. Jubaluk is working or not. Juberok volume is better or Juberok is better for scar treatment? Juberok dilution, and when we are diluting too much, well, the Juberok does not have that much of the augmentation effect. Juberok has a scar treatment effect? That's my question. Starting from Dr. Park. So what is your answer? And there must be some people who are using Juberok volume for scar treatment. Intradermal, shallow injection can have overproliferation. In that case, it can be negative. That's why I use Juberok rather than Juberok volume. For the rolling scar, Juberok monotherapy can be really effective, especially on the temple side. However, for the pox scar, Juberok alone cannot be that effective. And probably you need subcision and you need pumping devices. Sometimes I use the cross-linked HA. I'm not sure whether the Juberok volume can be really effective for this scar. Dr. Chung? This is something I already mentioned. My personal question is, Juberok can be used as a skin booster, and if each injection can create a volumization, it can be a problem. If Juberok can have the treatment effects for the rolling scar, well, I'm wondering, Juberok cannot have much of the volumization effect. It can have collagen generation effect though. If you want to have the volumization, in that case, Juberok volume can be better option for the scar treatment. You talked about the rolling scar. You used the Juberok or the Juberok volume. And when the scar is deep, I use Juberok volume. And can you tell us about the dilution? For the Juberok, normal saline 4 and 0.5 cc lidocaine and 1 cc of HA. So 5.5 is something that I prepare. As I told you, timing is really important. And for me, I usually follow the same formula all the time because I want to keep my step working with me for a long time. So I usually follow the protocol. Lenisna is a 6.5, lidocaine and lidocaine are mixed, so 9.5 or 10 is something that I prepare for the scar. That's what I prepare, 9.5 or 10 for the scar. For me, for the scar treatment, as you said, whether Juberok is better or the Juberok volume is better, I've been thinking about it a lot. I asked that to Dr. Song. Why is that? I tried many times. Sometimes I use the Juberok, sometimes I use Juberok volume, I change it the layer, I change it the methodologies, but what I can tell you is this. In the past, I have the two-layer, deeper 주베록 volume, shallow 주베록. But these days, I only use 주베록 as a monotherapy. 주베록 seems better for the patient's satisfaction. I use 26G for the 주베록 volume. And I cannot target intradermal even though I try. And even though I use the two-layer approach, 주베록 volume might not be working that well. And energy devices cannot reach the deep layer where 주베록 volume can be injected. So on the shallow area, energy device can be working and they can create some synergistic effect. Dr. Pyun gave a lecture when the particle size is big enough to a certain size and it can have more collagen boosting effect. So sometimes I use the two-layer, but I usually use 주베록 for the scar tissue. What Dr. Pyun is saying, when the particle size is higher than 6 micro, in that case it can have the collagen boosting effect. Dr. Patek, how do you use the Lenisna and the Jubaruk for the scar treatment?
I had many times an opportunity to present Lenista and Juvaluk for the first time for the country, for UK, for Czech Republic, for in France, for example, in Kasperi. And I presented, it's quite a big challenge to present such a product, perfect product for the first time, how to present it. And for me, Juvaluk volume or Lenisna is a volumizing product for deep injections. And Juvaluk is intended to inject intradermally, basically, for most of the applications. So that's why Juvaluk, another point is that it's unexplained right now why Juvaluk in many biochemical pathways or histological aspects, we do not understand fully why it is better, because there is no difference in substance, only the particle diameter. Smaller particles tend to act more actively, and there is probably, as I understand with many talks to Dr. Seo, there is more elastin stimulation compared to Juvaluk volume, I mean Lenisna. It's not completely understandable right now. That's probably why Juvaluk seems to be better, gives better outcomes in scar treatment, because it gives more complex effect on the skin biology, not only collagen stimulation, also elastin stimulation, and probably a higher level of stem cells activation. Thank you.
저는 제 거로는
Then let me put it this way. For this scar treatment, I usually do the scar treatment Jubaruk and the Jubaruk volume can be utilized. Sometimes I injected Jubaruk 25 times. Yes, the scar is getting better and better. And cross-linked HA was combined along with the Jubaruk 1-to-1 so that we can have some filling effect. HA boosting was made initially, and PDLA, the Jubaruk, was creating the collagen generation. With the overlap between the two, patient satisfaction was going up. So for me, rather than using the monotherapy, I use the combination therapy with light HA filler. And Dunefil is the product that I usually use as a HA filler. I use the USP Light. However, it can create some kind of nodule. So I use a high quality HA along with Jubelu. Then you can have an initial boosting effect, and later patient satisfaction about the scar can go up. We are well over delayed. This is the time that we should conclude the panel discussion. Thank you very much, Dr. Patek, Dr. Shim, Dr. Lee, Dr. Chung, Dr. Park. Thank you very much. Please give them big hands. For the last 2 days, we talked about Juveluc and the Juveluc volume. And actually, we need to study more. We should listen to the feedback from experts. And we should come up with a kind of protocol or the guideline. And we should have a living document, and we should update the protocol and guideline. And thank you very much for listening to us. Thank you very much.